So today we're going to discuss how much dialysis affects or disrupts lifestyles. For those who tune for the first time, I'm Dr. Francisco. I am a specialist nephrologist and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or at risk of kidney problems, or also to help their relatives to be better informed so they can take better care of their disease, minimizing worries, and take better management decisions with their own doctor or with me if they choose me, minimizing complications. So we are going to discuss how much dialysis affects or disrupts lifestyles. Obviously, every person has got a different lifestyle, and every person has got different personality, different medical conditions, different environment. So everyone is going to be affected differently. But I will be just talking in general how dialysis affects the lifestyle of most people, and just mentioning how people probably can approach this so like indeed their lifestyle doesn't get too disrupted. Let's start. Reaching total kidney failure and needing dialysis is indeed a huge event in the life of patients and their families. Not only in the physical, but in the emotional, social, professional, or school-related financial components. We cannot deny all these consequences do occur. But we cannot forget that without dialysis, once developing total kidney failure, the general well-being of the patient and his or her life will be in danger. So it is necessary to go through it, make the necessary arrangements and adjustments to get on top of the disease, as I always mention, rather than the other way around, and embrace dialysis. Despite how difficult this might sound or this might seem, embrace it as a new stage of your life or the life of your loved one. But true, most of the time it requires huge modifications in the lifestyle of patients and their caregivers, affecting many aspects, as I mentioned, related to the family, social, work, or school life. But with the right support, most patients can adapt well, especially if following general recommendations and taking charge of their own care. All these modifications, new advice, and some recommended restrictions, especially in diet, are necessary to ensure you take good care of yourself, your disease, your health. But all these modifications and restrictions are not necessarily forbidden or forbid that you enjoy life or forbid you to do the things that you like. Indeed, you might need to modify things a bit with less intensity, less frequency, etc. But definitely, you should not defeat yourself thinking that dialysis has taken your freedom, your choice, and your life. It is easy for me to say, but I can imagine all the struggles you or your relatives can be facing. But I have seen patients that approach their disease in a different way, with a different mood, with a different mindset, compared to patients that do it differently. And I can see the difference in their well-being, physical and mental, and in their medical outcomes. People who indeed have a more positive approach and embrace this as a new stage and try to adapt as best as they can and learning in the process, but always looking forward, tend to do better than patients that get too overwhelmed by the disease and the consequences. Indeed, it is overwhelming, can be very overwhelming, but as I mentioned, with the right mindset, the right support from your family, your loved ones, the community, the healthcare system, it is not as difficult as it might seem. Many patients are concerned, in fact, on how dialysis will affect their work life, and they're worried about losing their job and all what that implies. And this further brings lots of unnecessary stress. Hemodialysis is most likely to impose in your work life than peritoneal dialysis, as we discussed in previous sessions, because you can do peritoneal dialysis at home and you can do it at night, but indeed can disrupt your sleep, yeah? In some patients, not in everyone. And this disruption of work life by hemodialysis, especially if you have a corporate or a full-time job, because each session can take at least half of your day, especially if you need to commute and you need to, rest after the dialysis, etc. And even your life can be affected more because all the time that you spend on your dialysis will probably, cause you some issues or nagging at work, and you will have difficulties to maintain your job or worries that you might be retrenched. It has happened. It's sad. I always believe employers should be kinder. Living with kidney failure is not easy. So if they don't know it, there should be a system to try to make them know. But it's a reality. It has happened. And it's quite sad. Your family and the social life also will likely be affected. But you can arrange meetings and events around your dialysis sessions. It is not ideal, but you have no choice, unfortunately. But you can just play around it. And sometimes if an important occasion is in the middle, you can ask your dialysis center to change one off the time or date of one of your dialysis to permit an important celebration or a holiday. As I mentioned, you can play around it. It is possible. But I know in practice, this is more difficult because many centers don't have too many available slots. But just ask. Discovering having kidney failure and going through the process of accepting it or already undergoing dialysis can affect also your personal life. It can affect certainly your mood and overall mental well-being. It can affect even your sexual life. And through all that, all the physical issues or the psychological consequences of that, causing more stress, in return can affect even more your physical well-being. But I say again, with the right support, this can be different and the consequences can be diminished. And in some instances can go. I have seen patients that they just do the disease, they do the treatment, they carry on with their life like if it's just like paying a tax. or just do a chore, etc. Yes, you need to take good care of your disease, your dialysis. But once you're done, what you need to do, carry on life as normal, as normal as you can. Because remember, normal life also requires moderation. So please read me properly on that, yeah? This is indeed a big challenge. It's a huge task, but it's not impossible because there are many cases. You just can set your mindset and actions into positive ones, more empowering ones, believing that there is a life beyond and despite dialysis, a life that you can still enjoy, believing that you can still perform in life. There are many people on dialysis that work and they are successful and they're making money, or they are making other people happy, or they are helping others, or they are teaching, or anything, or they are motivating other patients to do hopefully as well as they are doing. You can still enjoy life despite dialysis, and simply with a supportive network. So that's why, great part of the focus have to be to you get the right support, or invite inside the bodies in charge of this in your community to tailor the support to your needs that, as I mentioned, are a little bit different from other patients or other people. Having the right support from this network, care providers like me, the community, it can make a difference. There are many people that do it. I can tell you, if you are unfortunately in this situation, as I mentioned, take care of your disease, take your medications, try to follow the diet and all the recommendations that we have spoken, or we still need to speak about them in following sessions. But then try to do your activities as normal as possible when you are not undergoing dialysis. If you like to go to the movies or go to the museum, go for it. If you like to walk in the park or on the beach, just go for it. If you like to do sports, you can still do them. You might need to bring down the level or intensity or the competitive level or whatever, but you might still be able to do them. Or just double check with your doctor what level of activity can be appropriate for you, as your overall health might change as the kidney disease is progressing, around the time you develop total kidney failure, and can change continuously, as unfortunately, complications can add up as the time passes by on dialysis. But many patients can continue practicing sports, just simply to take more precautions. Or if you couldn't do it competitively now, you can still play with your mates that they know that they can just play for fun, or you can play with your children. There are options always. Also, diet is a huge aspect of the lives of patients that get affected. Probably we will talk about diet in future videos. But indeed, patients on dialysis need to improve their diet, and they need to follow the so-called kidney diet, which is indeed not as varied, as palatable as your previous diet. But if you see a dietitian and you are a little bit open, you can start trying to get some replacements, some other foods that can give you some taste, and play around to try not to be so unpalatable. Also, if you start with a positive mind of taking these changes, you will realize that little by little also your palate can adapt to less salt, etc. Because all your efforts in general recommendations and in diet will pay quite well. You need to see it from the perspective that is an important channel to achieve your health goals. Having a good diet and a good lifestyle. Your efforts and your frugality will increase your chances of living a longer and better life than if you are not taking the right precautions and modifying your diet accordingly to your medical condition. In my experience, I keep repeating, but because I'm just trying to encourage you to see if you are not in that track, try to move to the other track. I repeat, in my experience, most of my patients that live a more frugal life with diet control, you don't need to be totally religious and you cannot eat this, etc. But most of the time you need to control your diet. But most of my patients that try to live a more frugal life, eat a frugal diet, control their fluid, take the medications, do exercise, and also have a positive mind, tend to live a healthier, happier, longer life. While on dialysis, I've seen patients 30 years on dialysis, and still it looks like they will have so many more years to go, which unfortunately others, the outlook might not be as good. Indeed, sometimes you might have some conditions that, really decrease severely your chances, but you can try to boost that if you energize yourself, your spirit, your mind, and you follow, sound and compassionate medical advice. In short, just get on with your treatment, and after done, try to set your mindset back into normal life, or almost normal. And then aim to do the things that you used to do as best as you can. It is not simple, but I trust you can do it, because I have seen it. And it will be simpler with good family, social support, and the support from healthcare providers or your government. In Francisco Kidney Medical Center, we provide empathetic, approachable, and flexible specialist renal and medical care for a reason, because we can imagine the struggles our patients and their relatives could face in these situations. And we hope our patients adjust, and we hope also you too, as soon and as best as possible to their new stage in their life. If you need our help, please contact us. The contacts are in my Facebook page, my website, etc. Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.